You are on mute, sir.
Sorry. Good afternoon, all of you who have been able to come on time. I know it's a Sunday afternoon and all are busy in the kitchens, but the subject is equally important. And this is the only time we have had to get Dr. Manveen Lamba on board. She has specialized in pediatric dentistry, the dental bond in Andheri. This is a specialty dedicated to treating children from birth through adolescence and those with special health care needs. You have seen her on screen now. Her cheerful demeanor makes sure that all kids receive equal top notch treatment. She is well adept at communicating with kids and their guardians, and she strives to make their dental visits the utmost cozy and comfortable now and for always. She believes in creating a positive dental attitude in all patients, as she has been well trained in behavior management techniques for all age groups and also sedation dentistry. With that, ladies and gentlemen, I hand over the floor to Dr. Manveen Lamba. Doctor, the floor is all yours.
Thank you so much for the introduction. So, this is Dr. Manveen Lamba. I am a pediatric and preventive dentist, and I'll be hosting this session for you all. A dash a day keeps the dentist away. So, let's all find out what is the fill in the blank through this session. So, I'm speaking to you all on behalf of our team, the Dental Bond. So we are a team of all specialist doctors. We are just not another clinic wherein a general practitioner, a general dentist is going to look at every aspect of your tooth. We've got different specialists who are trained globally. And all of us, we pay special details, special attention to details. And we have state of the art technology. We provide you the best dental experience possible. And we take pride to say that we have the best sterilization procedures and we have US FDA approved sterilizers and we are at par with any other best dental practice across the globe. So this is our team of specialists. Towards the left, we've got Dr. Hussain, who pays attention towards prosthodontics and implantology. On the top, we've got Dr. Farhat, who's a root canal specialist. On the bottom, we've got Dr. Kalpana, who's a cosmetic dentist. And towards the right is me, who's a pediatric and preventive dentist. All of us make sure that comfort, all efficiency in your treatment, your every detail is paid attention to, and we walk you through your dental experience. So, this is my introduction. I've been working as a pediatric and preventive dentist across various hospitals and private clinics across Mumbai since 2017. Okay, so now let's begin with what are cavities. Now, through this session, I'll be answering the most commonly asked questions by the parents of my patients, the questions we come across most frequently, the myths I'll be busting regarding the various child health care. So now basically what are cavities? Cavities, as we all know, are these black spots we see on the teeth of children. Now cavities, also called as dental decay or caries. This is the most common childhood disease. Most common childhood dental disease rather. Now, if these are left untreated, what happens is it progresses. Progresses towards lesions, progresses toward toothache, swellings, and this is going to hamper your child's daily activities like eating, speaking, playing, paying attention in school. So if you look at statistics, statistics show that children who do not have a who have a poorer oral hygiene rather, they are going to have a poor quality of life. They won't be able to pay much attention in school as compared children who have a good oral hygiene. Now we need to understand as parents how do these cavities occur in children. Now the most common reason is because our lifestyles have changed. What do I mean by lifestyles? Our food habits, our lifestyles have become more westernized, whereas the way we take care of our teeth is still very Indian. So here there's a loss of balance, and this loss of balance is giving rise to cavities. Now, when we say the lifestyle has changed, the food habits have changed, what we have incorporated is a lot of refined carbohydrates. I'm sure all of you all are going to agree to this, that we do have a lot of maida, we do have a lot of sugar, starch, pizza, burger, all of this in our diets these days. So what happens is we are increasing the carbohydrates, the fibers have gone down because fruits and vegetables are going down. We are not using adequate preventive dentistry measures. We are not using adequate oral hygiene measures. We're not frequently meeting the pediatric dentist. So all of this cumulatively has given rise to increased cavities in children. Okay, now all of us have some bacteria in our mouth. A few of these bacteria, they are caries forming, that is, they are cavity forming, a few are not. Few children will have more of the cavity forming bacteria as compared to others. We do not have any hold on this. This is all natural. But what we can hold is the diet. Okay, so now this bacteria, when it comes in contact with your refined carbohydrates in the form of your cakes, pastries, chips, your pizza, your burgers, Coca-Cola, all of this, it is going to interact. The bacteria will ferment the carbohydrate and it is going to produce a byproduct. This byproduct is an acid. Okay, it's a lactic acid. Now, this is going to go and dissolve your enamel. What is enamel? Enamel is the outer covering of your tooth. Now, when you pour some acid on a tile, what do you see? You see some kind of a frosted appearance or some kind of an etched pattern. This is similar to what happens on your enamel. On the tooth enamel, when there is this acid formation, there's going to be an etched pattern. So you're going to be losing the minerals from your enamel. Okay, so the acid on the tooth is going to lead to demineralization. So what's happening is refined carbohydrates plus the bacteria is producing acid. That acid is going and demineralizing the tooth. Now the minerals are going, and with frequent attacks, what happens is you see cavities. Eventually, these cavities are like black holes on the teeth, which you can see towards the left side. Now, if this progresses, now this cavitated lesion, the hole, it is going to harbor more food, more bacteria, more acid, and eventually will go and reach the nerve wherein you have swellings, you have infections, you need a root canal, and then a cap. The entire vicious cycle begins. Now, towards the right, you can see a little boil on the gums. That is a swelling, which is why because the cavity was left untreated. Now, this is another unfortunate question which I'm very frequently asked. These are baby teeth. They're going to fall off anyways. Do they require treatment? Okay, so they are, of course, going to fall. But what we need to understand here is that the age at which these teeth are going to fall is all different. The front teeth, they're going to fall around when the child is around 6, 7, 8 years of age. But the back ones, the molars with which your kid is going to chew the food, they will fall later on in the years to come, say around 10, 11, 12 years of age. So, up to that age group, what we have in our mouth are these baby teeth. So, these baby teeth are the ones which are going to be helping your kid to chew his food well. These baby teeth are going to help him, guide the permanent teeth to erupt in the mouth well. They are also, along with the various muscles along the mouth, they're going to help in the growth of the jaw. And not to forget, these baby teeth are going to provide your kid with a very healthy and beautiful smile. So yes, these teeth are very important. Yeah, they're going to fall off anyways, but their maintenance is very important. Just in case a cavity has begun, it is very important to treat it as soon as possible. Okay. Now, can the milk teeth get affected? Okay. This is again very unfortunate. Yes, your milk teeth can get affected. They can have the similar toothache which a permanent tooth can have. But the good part here is this is completely preventable. And prevention is very easy. It's not very difficult. But we as parents, we need to understand what has to be done right, what has to be done to prevent this, and when it has to be done. So this is what I'm going to be telling you all through this session. Now, another thing which we need to understand is about sugars. Now, what is the right age to introduce sugar in a child's diet? Now, children, they have a lifetime to enjoy their sugars. They have a lifetime to enjoy their desserts. But we as healthcare professionals, we are going to advise you that the more later you start with your sugar, it's going to be better for his teeth. Because sugar is very addictive. Once the kid, he likes the taste of sugar, he will only ask for it. And we as parents are then going to be compelled to give every meal sweet. And this is a very big detriment because once he likes sugar, it's very addictive. There's no way going back. So later you introduce, it's better. So what we recommend is, as pediatric dentists, up to 3 years of age, you do not introduce any sugar, any refined sugar. What you can introduce is fruits. Now fruits are an amazing meal. They have natural sugars. You should go with all the seasonal fruits. Any watermelon, bananas, mangoes, pineapples, everything is good. Give the child every fruit possible, but do not give him refined sugars till 3 years of age. Eventually when he goes to school, he is going to be tasting all the chocolates. People are going to be giving him chocolates. There's no way there. But up to 3 years, he's in your hands. Take care of the kid that time. Okay. Now, a few parents come and tell us that we do not give our child chocolates, we do not give them chips, we are not giving them soft drinks. So, does that mean the child is going to be safe from cavities? So, the answer is no. It's a very good thing that you are stopping the chocolates, the chips, and the soft drinks. But there are some things which have some hidden sugars, where we as parents, we are very innocent of the presence of these hidden sugars. Now, if we begin our day with cereals, and if these are the packaged cereals, say for example, the Fruit Loops or the Chocos, now they are loaded with sugar. So beginning of the day, so much sugar is not good for for your kid and his overall health. So what you can give instead is give him a porridge, make an oats porridge, make a ragi porridge. You can give him upma, poha, a paratha, idli, whatever suits your family. If you want to sweeten any of this, you can use a chopped banana, a chopped, apple, strawberries, anything. Dates can be used. So this is like a wholesome, healthy meal without any addition of sugar, which is very good for your kid. It provides all the essential minerals, the vitamins, provided no sugar. Now, biscuits. Now, biscuits are marketed so well. They have such amazing commercials. In the supermarkets, also, always you'll find them at shelves which are, lower so that the child can go and pick them up. They have colorful packaging. Now, because of this marketing, we parents and children fall prey to the biscuits. But basically, biscuits are nothing but only refined carbohydrates. There's no vitamins and no minerals, only maida. So, this is something which we have to avoid for our children because this is very sticky. Any sugar which is sticky is going to be more bad. It's going to be worse as compared to something which will go in early. So if you're giving, maybe a Pepsi or Coca-Cola, something is going to just go in early. And this is something which is sticky. So this is worse compared to your soft drinks. So no biscuits. Okay. Now we love giving our children, potato chips, banana chips in their tiffin boxes, in their snack boxes, because it's easy. But this is again something which we have to avoid. It's a total no. Bread with jam, bread with chocolate spreads, with Nutella, again a no. Refined carbohydrates. So what are the healthy options? We can give them nuts. Nuts are very healthy. Any, almonds, cashew nuts, your walnuts, anything. If your child is not allergic to any of these nuts, it's an amazing deal. You can go with makhanas, you can go with khakras, anything like idlis, dhoklas, whatever suits your family is going to be a very healthy option. Now, let me tell you, cheese is an amazing option. A cheese cube a day is going to keep the dentist away. Okay, so cheese has lots of calcium and phosphates. Now, when I was talking about the loss of minerals from the enamel, this cheese is going to get those minerals back to your enamel. So this is kind of going to remineralize the tooth. So cheese is very good. One cheese block a day keeps the dentist away. The more home cooked your food is, it's going to be better. It's going to be healthier for the kid as well and for his oral health as well. Okay. Now we've understood one aspect. We've understood how to control the diet. The next important aspect here is going to be to maintain the oral hygiene. So do toddlers need a toothbrush? Now, as Indians, we are obsessed with bathing the newborn. We are obsessed with, massaging the newborn. But what we're not obsessed with is brushing the newborn's teeth. Okay. We do not know when to begin. So we have to begin when the first tooth erupts in his mouth. Why so? Because when that first tooth erupts in the mouth, there's going to be that tooth is going to be exposed to a lot of liquids, maybe juices, the milk the kid is having, to food which he's going to be having. That food is again going to be sticky, will stick around that tooth, form plaque, lead to cavities. So what with brushing, the action of brushing, what we're doing is we are removing the plaque. Now this plaque is very sticky, very tenacious, so we have to brush really well. And if we start early, your child is going to accept the brushing. He won't resist brushing later on. So, brushing is going to become a very simple act for you. Now, what kind of brushes are you supposed to use? Now, when the first tooth erupts, it's going to be around 6, 7, or 8 months of age. So, around that age, you will begin with a baby brush. Okay, the one you can see towards the left. Now, there are a lot of silicone tips. There are a lot of these finger brushes available in the market. But this is not needed. Why? Because these bristles are not very efficient in removing the plaque. Our basic aim towards brushing is to remove the plaque so that we can have a very cavity free, very healthy mouth for our kid. But these are not very helpful. So, what we are supposed to begin with is a baby brush. Now, this baby brush can be continued till around 2 to 2.5 years of age. After that, we go to something called as a junior brush. Now, these junior brushes are the ones, they are the 5+ years of age. Okay, they're available for 5+ years of age in the market. Any questions, you all can put them in the chat box and we'll answer them later on. So these are the junior brushes which can be used after the kid is around 2 to 2.5 years of age. This is about the toothbrush. Now coming to the toothpaste. Now there are a lot of controversies over whether to use a fluoridated toothpaste or a non-fluoridated toothpaste. So according to international, articles, what it is that very young children are not supposed to be given fluoride. I'll tell you the reason here. The reason is that these children, they do not have a swallow reflex developed till 6 years of age. So they cannot spit it out. So when they're brushing, they're actually playing with it and they're actually having the toothpaste. They're liking it. It's very tasty, the children's toothpaste. So they're actually eating it. So the fluoride is actually going in. Now, when this fluoride goes in, it can cause fluorosis, skeletal fluorosis, can hamper the IQ as well. So we do not want this happening, right? So we can go for something as a non-fluoridated toothpaste. Chico is one good company. There is another one which is called Mimi toothpaste. Very good to use in the new years of age, in the early years of age. Now, how do you brush your infant? So we need two individuals for this, you along with your partner or any other caregiver. So you all sit in a knee to knee position. The kid's head is facing you, legs facing the other partner. Very lightly, you will restrain the kid's hands, then flip the lip, and then you gently start scrubbing his teeth. Now, again, when we are scrubbing the teeth, it has to be in 6 areas: front, top, bottom, sides, top, bottom. Very gently keep scrubbing every part. Now, each area, you have to look into three surfaces: the outer surface of the tooth, the inner surface, and the chewing surface. So, this is the way you're supposed to brush for your infants and toddlers up to 2 to 2.5 years of age. Okay. Now, once the child can brush on his or her own, do you just leave the kid or do they need supervision? Now, this is very important. Brushing is something which requires a lot of dexterity. It requires fine motor skills. Okay. So, the child cannot brush his teeth up to the age of 6 years. So, what do? We have to brush for them. Mornings and evenings, the parent or any other caregiver has to take up the responsibility to brush for the kid. Okay, so we generally say it's the time till the child can tie his own shoelaces. It is then that the child can start brushing. Because it has to reach the places well. It's only then which is when it is, solving the purpose of removing the plaque. So now when the kid has grown beyond 2, 2.5, you can make the kid sit on your lap or stand in front of the mirror with the kid in front and you behind. You gently hold his head so that you can stabilize the head. And again, you start brushing. You lift the lip and then you start scrubbing the teeth, outer surface, inner surface. For the back teeth, you lift the lip, you pouch the cheeks. Again, outer surface, inner surface, chewing surface. Chewing surface is very important. You can also do something called as a cross brushing, horizontal cross brushing on the teeth. Now, what is the best toothbrush and toothpaste for children? Now, needless to say, we all know that we have to brush our teeth twice a day, morning, evening. But we as Indians, it is very difficult for us to accept the nighttime brushing. Now, I get a lot of questions from parents that, my child doesn't like to brush in the night. Why? So, because we don't like to brush in the night. Even I find it very difficult. But since I keep saying it, I have to practice what I preach. So, nighttime brushing is something which the parents have to start doing themselves. They have to first accept it, and then, the child is going to see him, and then it's going to be a non negotiable task for the kid. So, then they know it that yes, I have to brush, and only then I'm going to sleep. So, parents have to first follow this, and then the child. Now, as I have already told you, after 2.5 years of age, you're using a junior brush. Now, another frequently asked question is about the electric toothbrush. When can you begin with this? Now, see, electric toothbrushes, they are going to do the brushing very effectively, very efficiently, but only after the child has developed the dexterity. So that is after 7, 8, 9 years of age. Because, see, it will do the brushing action, but you have to take it physically to different places. So you need to move it. You need to know, okay, outer surface. You need to know now I have to brush the inner surface, now the chewing surface. So we've got a lot of these brands. A few of them, they play a 2-minute song. So every 30 seconds, the song changes. So that is when the child realizes, okay, now this side is done. I move to the right side. Okay, now I move to the bottom. So these are very good as they are very, the child is going to be very enthusiastic in brushing after using this, but after 6, 7, 8 years of age. Now coming to the toothpaste. So around say by 3, 4 years, you're using non-fluoridated toothpaste. Later on, when you want to introduce fluoride, now here again, we would like to prescribe the type of toothpaste only after we see your child, because if your child is more prone to cavities, we would like to give him a fluoride toothpaste very soon, earlier in life. But after 4 years, everybody uses a fluoride toothpaste containing around 1000 ppm. ppm stands for parts per million. Now, again, how much of the toothpaste to be used? Now, this is also very important for parents. Up to 2 years. So, beginning from 6, 7 months to 2 years, you're using very little. You're using only a smear of toothpaste. Okay, that is a rice grain size of toothpaste on the brush. And then you're pressing it inside the brush so that when you're brushing your kid's tooth, it's going to be releasing very slowly. After 2 years, say from 2 to 4 years, you can increase the quantity. You will use a pea-sized amount. Okay, again, you press it inside so that the release is very slow. And after 4 years, you can use a centimeter of toothpaste. Okay, so now we have completed how to control the diet. We've seen how to maintain the oral hygiene. Now, the third and the last important part is that you have to see the dentist very frequently. So, what is the best time to see a dentist? Now, the best time to see a dentist is not when there's a cavity, is not when you've already seen a black spot or already there's a toothache or a swelling. The best time is to see when the first tooth has erupted in your kid's mouth or the latest by the first birthday. Because we as pediatric dentists, we can provide something called as anticipatory guidance. We can guide you in the feeding practices. Okay, what's going wrong in the feeding practices? How long you have to feed in that particular manner so that it is not showing any adverse effects on your kid. Okay, so all of this is what we can train you in. Now, say for example, the kid is bottle fed for any reason. That bottle feeding has to stop by 1 year of age. You have to throw off the bottle in the trash can by the first birthday. Because when the kid is 1 year old, he is good enough to, drink water or milk from a sippy cup or say from a mug. If you're breastfeeding, which is one of the most healthy start, to the best life, so then you might like to continue that for like 1.5 to 2 years. But what we have to pay attention here is nighttime feeding. Okay, say for example, the kid is sleeping next to the mother. So the kid is going to be asking for a feed, not out of hunger, but out of a habit which is formed. So we want to stop this. Okay. So nighttime feeding is not recommended because that last, spoonful of milk is going to pool around the teeth. And if it's going to stay for those 6 to 7 hours when the kid is sleeping, again, bacteria is already there in the mouth. It's going to be acting with the tooth. Acid. Acid will lead to cavity. And in these very early ages, our child will fall prey to something called as early childhood caries. This is the most frequently asked question in my practice, that the permanent teeth has erupted, but the primary tooth has not fallen off. What to do? Now, why is this happening? Again, change of lifestyle. What we like eating nowadays is very soft food, very processed food. Okay. So we do not want to bite something which is hard. We do not want to have solids, fruits. We do not want to have salads. So that is why the teeth are not falling off on time. The teeth, they need some kind of pressure on them so that they fall off on time, right? So we have to incorporate raw food in our child's diet. So give him a bowl of raw salad before you give him cooked food. Give him apples with the skin on. Give him all the fruits with the skin so that they can bite. So that there's, the adequate pressure so that the teeth start falling off on time. Okay. Do children require mouthwash? Now, as I told you all that the swallowing reflex is not developed till 6 years of age. So if the child takes the mouthwash, he cannot spit the entire amount outside. He's going to take a little bit inside, which we do not want. So up to 6 years, no mouthwash. After 6 years, yes, we might prescribe you a mouthwash. That is only after the doctor has given you. It's not that you start with your normal Listerine or something or Colgate plaques after that. Only if the doctor has prescribed it for the kid, only then will a mouthwash help. Otherwise, not required. Brushing twice a day is just enough. Okay. A dental visit could be scary and overwhelming for my child. What to do? Now, generally, all pediatric dentists, they love working with kids. Our entire team, we love working with kids and we are very friendly. Our environment is going to be very child friendly. Okay, we've got different kinds of toys for the kids. We've got these drawing books. We explain every treatment to the kid on these models which have teeth. We also have certain monitors which are connected to our computers, to our chairs, wherein when the treatment is done, the child is going to be enjoying. He's going to be seeing his favorite cartoon or movie. So that kid is very relaxed. The entire team is going to pay a lot of attention to make it very comfortable, a very cozy experience for your kid. Now, what we need to understand as parents here is that what our fears and anxieties are going to go and travel to the kid. So we're going to translate that to the kid. So if you are scared, if your past dental experience was scary, was very painful, and you're scared about that, your kid is very sensitive to your body language. So you have to make sure of that. You have to be very relaxed. Even if you're scared inside, do not show it off. Okay, when you're taking your kid to a park, so you're taking him to the mall for the play area and everything. So you're very excited. Okay, the kid is going to be looking forward to it. Similarly, when you get your kid for a checkup or for a normal, a visit to a dentist, be very happy. Show him that it's a new area. A child is going to be always, excited for a new place. Do not show up the fear. Just make it a very pleasant experience for the kid. And later on, we'll do everything to make it comfortable. We'll walk the child through the experience. And just in case he has to go through some elaborate treatment, we are the dental bond. We've got something called as the happy gas, which is the laughing gas. So, okay, just in case your child is a little uncooperative, you do not want him to go through that negative experience, we do the treatment under the nitrous oxide sedation, which is the happy gas, which is very safe. Let me tell you, it is 100% safe and effective. It is applied on the nose. Okay, and the child is going to enjoy the treatment for like half an hour and then we're done. Now, why are these regular visits? Why am I stressing on the fact that you are supposed to visit the pediatric dentist every 6 months? That is because it is very unfortunate to see that, I see all my patients only when they have cavities, only when they have pain in their teeth, only, when there's a swelling there. Because if the family would have visited me earlier, I could have helped them to prevent all of this. Okay, so when the child is around 1 year, 2 years of age, if I would have seen the kid that time, we could have started with something called as preventive dentistry, which can prevent the cavities, the root canals, the caps, the vicious cycle. So what you see on the left side here is something called as a fluoride varnish treatment. It's a very simple treatment. It's just like nail varnish. There is, a tooth varnish, which is applied over all the teeth. It's dried and that's it. It will make your teeth, 20 times more strong. It will make them stronger. And towards the right, what we see is spit and fissure sealant. Now, on the back teeth, which are called as molars, you have these depressions. They're called as pits and fissures, these valleys. Now, these valleys are going to go and harbor a lot of food. Now, food here, sticky food, again with the bacteria produces acid cavity. So this is the area which is more prone to cavities. So what we do is we are going to seal off these cavities. We are going to seal off these areas so that they never have a cavity. So the pits and fissures are sealed initially only. So eventually no cavity happening in that tooth. So this is a way we can prevent cavities from occurring in your teeth. So that is why it is very important for you to take your child to the dentist even before there is a cavity, even before there is a toothache. So every 6 months is the best to visit a pediatric dentist. Now, this is the last topic for the day. which is very important for parents. Now, dental emergency. We have very few emergencies in, dentistry. So now when the child starts walking, okay, around 2 years of age, when he wants to run around the entire house, so that is the time they're more prone to accidents as well. They want to fall off that time. And we see a lot of injuries in the front teeth. Okay. And the second scenario is when they go to school. So, say around 6 to 7 years of age. So, these two areas, these two age groups are the ones which are more prone to accidents and trauma. So, what happens during this trauma is the entire tooth comes out in your hand. Okay. So, this is a very important dental emergency which you have to take care of. Now, if it happens in the first age group, that is 2 to 3 years of age, what do you do with that tooth? Nothing. You just throw it off. But if it happens around 6, 7 years of age or later, that means it's a permanent tooth. So, what do you do in that case? You store the tooth maybe in milk. If you have access to coconut water, store it in coconut water. Or if nothing is available, store it in saline or maybe just normal water. And this also only for the first 1 hour. Why do I say it's emergency? Because the tooth and your child has to reach the dentist in the next 1 hour. If you think you cannot take him to the dentist in the next 1 hour, what you do is you just clean that tooth, just place it in the socket and just leave it, just hold it, and just take the kid to the dentist as soon as possible. But this 1 hour is very important. So this is all that we had for you today. So there are three important aspects of pediatric dentistry and preventive dentistry. We've discussed all three. Number one, we have to control the diet. Number two, the oral hygiene measures. And number three, frequent visits to the pediatric dentist. If we follow these, we'll be able to give a very healthy environment, a very healthy start to the child. The healthy start is very important because these are the foundation years for the kid. What he's going to earn, learn early is what is going to stay with him throughout the life. So healthy start is very important in the long run. Now we'll be taking some question and answers right now, but any dental queries can be posted to us on any of our handles. We were an Instagram handle as the Dental Bond. We've got a Facebook account. You can post queries on the website as well. Our number is also here. We've got a lot of blogs on the website. So you can go through that, and we keep posting a lot of this information, a lot of dental content on all of these handles. So you all can keep following us and knowing more. Thanks a lot for the patient hearing. And now we'll take up your questions.
Thank you, doctor. That was very informative and quite sad that we missed out all this the last 60 years. Now, when we are over 70, we are getting to know the real truth.
Actually.
Most of them are parents and grandparents in this audience. Sabina, you would like to ask something? Sabina is there. Joyce, I can see.
No, Mr. Roy, thank you. I don't have any queries.
Ah,
I've also missed it for 50 years.
Joyce and who else? Sheetal, is that you, Sheetal Modi? Or is it? Joyce, any questions? What about Sashi?
Can you brief us a little on root canal, Dr. Lamba?
No, sir. Thank you.
Okay. So root canal is a procedure which is different for the kids and for the adults. Okay. However, we do root canals for kids also and for adults also. The kid's tooth is going to fall off. So what we fill in after the root canal is something which is resorbable because the tooth is going to fall off. Now, the first step in a root canal is going to be cleaning of the nerves. So, since the cavity has reached your nerves, that is the time it's giving you pain. And that is the time you require a root canal. So, first, we clean off your nerves, we enlarge that area, to receive a new material or some nerves. So for a kid, we'll put a material which is resorbable, and for adults, we're going to put some artificial nerves there. And eventually, we'll give you a good filling on top of it and a crown because that is going to reinforce your tooth. It's going to give the strength to your tooth.
Thank you, ma'am.
My pleasure.
A lot of this audience is from your Lokandwala, Oshiwara side. So if you could just inform them all about your location, that would help.
Yeah, so the Dental Bond Clinic is on the 7th floor in Samat Aishwarya building, where there's Marks and Spencer's. So Samat Aishwarya building in Oshiwara. It's on the 7th floor, the Dental Bond. You all can Google it. And we've got all state-of-the-art technology. We've got a good blend of technology. We've got all specialists in our clinic who are going to be taking care of all aspects of your oral health. We have the best hygiene that we maintain. There is US FDA approved sterilizers. We are at par with any clinic globally, you can say. The best hygiene is maintained. So it's an amazing practice. You can come over, come for a visit, have a consultation, and you will see the difference for yourself.
Thank you, doctor. Just one query. Can you just give your background in the sense from where you did your BDS, MDS, and other certifications? I'm asking because my daughter is interested in pursuing medicine. That's the reason I'm asking.
Okay. So I've done my BDS from YMT Dental College, which is in Navi Mumbai. And then I went ahead and I appeared for NEET. And through that, I got my master's in pediatric dentistry in Nagpur. It is from SDQS Dental College. And then
Great.
since then, I've been, working as a pediatric and preventive dentist with various hospitals and private clinics in Mumbai.
Great. Thank you so much.
Most welcome.
Sashi,
Yes, sir. Yes.
on Saturdays we have these career option sessions where we have this Dr. Rajesh Salve from Nagpur who briefed us about all this. Maybe you should have attended that.
No, actually, she is interested in medicine only, so I was just interested. Like in medicine, what like I'm looking out for colleges and all now, na? So
Yes,
that's
yes.
the reason I wanted to know which college she
Okay,
wants.
okay, okay. I think the rest are all. I've just come to listen to you. Melki, any questions?
No, not really. Right.
Okay, all right. I think then it's time to wrap it up. We were all are full of knowledge after this session. There's no much questions there. So,
I
Doctor.
think Dr. Lamba explained it all very well before we asked any questions.
Thank you so much.
Yeah, it was very explicit. There's no doubt about it. Thank you so much, Dr. Lamba. You've been very
My
kind.
pleasure. And thank you for having me. Thank you for the patient hearing.
It's very informative. And now, when you have spoken about pediatrics, do you all have that middle age group doctors with you all in your team?
Yeah, so we've got Dr. Hussain, Dr. Farhat, which are like root canal specialists and prosthodontists. We've got Dr. Kalpana, who's a cosmetic dentist. So I'm the one who will be looking after kids up to 14 years. Beyond that, up to 80, 90, we've got in our team every doctor
No,
who's
now
going
we
to
have
take
grown
care of
up.
kids.
Now we are 14 plus.
So we've got those doctors as well.
Maybe I should talk to either you or Kalpana and
Yeah,
try and fix up the next session, maybe next month or whatever, at some convenience,
got that adults.
suitable time. Yeah. Thank you so much. I won't take today is a busy day for you all also. You all are working today on Sundays, no?
Yeah, we're working. The clinic is open on Sundays.
Yeah. So thank you so much.
Most welcome.
Thank
Thank,
you, doctor. Thank you, Roy.
thank you, all of you. Thanks for coming. Good day. So we'll end today's session with this vote. Yeah? Thank you.
Okay.